Hello, everyone. My name is Barry Carifonge. I am a nurse case manager for the African American Health Program, a contractor of Montgomery County Department of Health and Human Services. Why am I here? I'm here to help you learn about the diabetes checklist, which is a way to self manage diabetes. Diabetes is an epidemic and is the seventh leading cause of death in the United States. Our objectives of the day are to understand why diabetes is self managed and to use the checklist to track our health and to know your numbers. Why? Because it is very important that you know 90% of diabetes care is self managed. You provide the care because it enables you to be the best self manager possible. The tracking tool will help you to keep a to do list on how to take care of your health. And there are seven core focus areas on this tracking list, which are self care behaviors for managing diabetes effectively. Diabetes is a complex and serious disease, and managing it every day can be challenging. To help you, diabetes care and your education specialist will all work with you as a team to develop your skills in these critical seven focus areas. And so you and your diabetes education specialist can help to set the priorities and coach you better on each of these seven core areas, which are healthy eating, physical activity, monitoring, medications, reducing risk, healthy coping, problem solving, and the clinical test to monitor your health. What you need to know from head to toe. Let's start with the end in mind. Poor control can lead to complications and even death. We need tight control from diagnosis. Having diabetes makes other health problems more likely. Extreme high blood sugar levels can cause damage to the blood vessels and even your nerves throughout the body, loss of consciousness, and even death. This can lead to heart disease and stroke, and kidney disease, damage to the eyes, pain and loss of feeling in the feet, and slow healing of infections and wounds. Fortunately, you can reduce the complications of diabetes through healthy eating, exercise, weight control, controlling blood pressure, cholesterol, and even taking medications and not smoking. And so the first step will be to eat a variety of whole grains, fruits, vegetables, limit salts and trans fats and saturated fats. The Power Plate is a helpful tool to help you know how to set your plate when you're eating. There are four main food groups that you need. Half of your plate should be filled with fruits and vegetables, and the other half should be grains and legumes, things like beans and greens. Healthful eating. Having diabetes doesn't mean you have to give up all your favorite foods or stop eating at restaurants. In fact, there is nothing you can eat, but you need to know that the foods you can eat affect your blood sugar. We recommend you eat whole grains, 3 or more servings per day, fruits and vegetables, 3 or more servings per day, legumes, 3 or more servings, nuts and seeds, at least an ounce per day, and limit the use of vegetable oils, dressings, or high fat condiments. Healthful eating refers to a pattern of eating high quality, nutritionally dense foods in the amounts that lead to better health and wellness. A healthy eating pattern contains a variety of colorful vegetables, fruits, whole grains, dairy, lean sources of protein, and oils, while keeping your salts, added sugars, saturated, and trans fats to a minimum. What you eat, how active you are, and the medications you take work together to help you reach your diabetes care goals. Healthy eating has a big impact on your diabetes management and involves important skills such as measuring foods to get familiar with your portions, determining the correct portion sizes for you, reading labels, timing your meals with medications, and being aware of counting the carbohydrate foods you eat to better understand the impact of your blood glucose. And so you should avoid all animal products, including meat, chicken, fish, pork, dairy, and eggs. Limit sodium to 2,300 milligrams per day. Try to drink 8 cups of water per day, unless directed otherwise by your provider. And don't forget to take your vitamin B12 supplement. Physical activity. Being active is not just about losing weight. It has many health benefits like lowering cholesterol, improving blood pressure, lowering stress and anxiety, and improving your mood. If you have diabetes, physical activity can also help keep your blood pressure levels normal and help you keep your diabetes in control. Recommended for you is aerobic activities, at least 3 to 5 moderate to vigorous sessions per week. Resistance exercises, 2 to 3 sessions per week. Alternate the days so that you don't do them back to back because sometimes you can feel sore to your joints when you start. So take it step by step and always tell your doctor before you start any form of physical activity. Most important is for you to avoid a sedentary lifestyle, which is about just sitting around for more than 30 minutes. Monitoring. Checking your blood sugar levels regularly gives you vital information about your diabetes management. Monitoring helps you know when your blood sugar levels are on target and it helps you make good choices, making food and activity adjustments so that your body can perform at its best. Taking your medications. There are several types of medications that are often recommended for people with diabetes. Insulin, pills that lower your blood sugar, aspirin, blood pressure medications, cholesterol lowering medications, or a number of others may work together to lower your blood sugar levels, reduce your risk of complications, and help you feel better. In reducing risk, having diabetes puts you at a higher risk for developing other health problems. However, if you understand the risk, you can take steps now to lower your chances of diabetes related complications. Reducing risk means doing behaviors that minimize or prevent complications and negative outcomes of prediabetes and diabetes. For example, these behaviors are making positive lifestyle changes, participating in type 2 diabetes prevention or type diabetes self managed education and support programs, getting adequate sleep, getting the recommended vaccines and health screenings. Reducing risk means you need to acknowledge that the preventive action you do now will benefit you years from now, and that you have the power to change your health outcomes. Diabetes can affect you physically and emotionally. It's natural to have mixed feelings about your diabetes management and experience highs and lows. The important thing is to recognize that these emotions are normal and take steps to reduce the negative impact they can have on your self care. The most important thing is to realize that help is available. Your diabetes care and education specialist, your provider, and your support systems, such as your family and friends, are there for you. They can help you problem solve any self care issues you're having in order to lower your stress and improve your ability to cope. Seek support. It's important to have a network of people you can turn to. Attending diabetes education classes or diabetes support group can help you manage your diabetes and better cope with your feelings. Take the time to build healthy bonds that work for you and support you in your journey. Remember that you're not alone. Move your body. When you're sad or worried about something, go for a walk or bike ride. Research shows when you are active, your body or your brain releases chemicals that make you feel better. Think positive. It may sound too simple, but having a positive attitude really helps. Think about and celebrate the successes you've had managing your diabetes, even the small ones. Think about the people and activities in your life that make it enjoyable. Recalling the good stuff will help you get through the tough times. Be good to yourself. It's important to feel good about your successes, but it's also important not to beat yourself up if you fall short of your goal. Maybe you're expecting too much. Maybe you're trying to change things that are beyond your control. Do the best you can, look at what worked and what didn't work, and then move on. Do something that you enjoy every day. Problem solving. Do you feel confident you can take care of your diabetes in challenging situations? Diabetes wellness. There are other things on your list for you to check annually. Check your cholesterol, also known as the lipid profile. Check your urine, check your eyes, and check your feet, and take your vaccines. A simple way to remember it is the ABCs of diabetes. These are the items you should check yearly. Your A1C. A1C is the average blood sugar level over the past 3 months, and it's measured in milligrams per deciliters. Your blood pressure, your cholesterol. Don't smoke, get help if you're feeling depressed. Exercise, check your feet, and check your blood glucose for control. And of course, keep up with your hygiene practices. Always take your medicine in the right time and at the right amount. And you can use even medication app reminders. Having diabetes makes other health problems more likely. Discuss any concerns with your healthcare provider in managing your care and ask for resources. This brings us to the end of our session today. Enjoy the power plants. Thank you.